and welcome to a new podcast by Hubmed Ed, where knowledge meets innovation. Today, I'm super excited to be accompanied by a very well-renowned authority in plastic surgery, Dr. Kevin Keller. Dr. Keller, welcome.
Thank you. Thanks for having me. I'm happy to be here.
Dr. Keller is the founder of Upstate Plastic Surgery Clinic in North Carolina, and he's been operating in this clinic for the last 25 years. So it's a long ride, so you can understand the level of expertise this doctor brings today to this podcast. But I would like him to introduce himself to all of you so that you get to know him a little bit better. Dr. Keller, could you please tell us a little bit of your long journey?
Sure. So we're in South Carolina. Many people get North Carolina and South Carolina mixed up, but I'm born and raised in South Carolina in the U.S. I did my undergraduate here at Wofford College in Spartanburg, my medical school at MUSC in Charleston, and then I did general surgery in a community program here, also in the upstate, and I finished my plastic surgery training in Lexington, Kentucky under Henry Vasconez. I then immediately came back to my home area and opened a plastic surgery practice where I was the founding partner and eventually added 3 new partners over the course of about 25 years. About 3 years ago, I decided that my wife she's an OBGYN, which was very instrumental in me developing my career because I had a lot of good referrals. But she decided to back down a little bit on her schedule, and so did I. So I gave up surgery and just focused on aesthetic medicine and non-surgical options for patients because there's a huge patient population that doesn't necessarily want surgery, but they want to continue to look and feel the best they can. So that's where I ended up with Augusta Road Aesthetics, which is where I am right now in Greenville, South Carolina. So that's my career short form. I did, 25 years of private practice surgery, not counting the 7 years of training that was involved in general surgery and plastics.
Well, you already mentioned one of the moments that defined your career, but if you have to look back to these 28 years of practice, which would be one of these few moments that make really a switch in your development at professional level in aesthetics?
So I think anybody in my age group or category would identify with the period of time when silicone implants were not available in the United States. So those of us that trained around my era, we trained in with saline implants. That's all we had available to us. So we didn't have any hands-on experience when we graduated our programs in silicone implants. So in 2006, the FDA approved silicone gel implants back into the USA. And so we, after had developed our practices based on implant that's deflatable that you can roll up and put through a tiny little incision, we had to figure out how to put a silicone implant through that same incision. I kind of built my practice on an underarm incision, so that axillary incision is very difficult to approach with a pre-filled silicone implant. So therefore came the Keller Funnel through a couple of different generations and a lot of help from my biomedical engineer co-founder of the company. We developed a funnel device that has a specific lubricant, and so it allows you to actually propel the implant through the incision and into the pocket with minimal or no contact with the skin, very little trauma to the implant or to the patient as well. So that was probably a turning point in my career because I guess that's part of my identity is the development of that device, and it has become in a lot of places the standard of care, and it is worldwide, which is, it humbles me to think that device, which was meant to make my life more simple, has become so important across the across the globe.
Yeah, indeed, innovation in this case, as usual, always brings easing up our life and making also the results better, because I know that the patients were seeing their risks minimized and all the potential infections were reduced considerably. So can you explain us more the results and the benefits that the Keller Funnel brought to the patients since 2016? Since 2006, it's already 19 years. So it has already showed a lot of results.
So, like I said, I developed it to make my life more simple, but the background on that, and I actually, probably 3 or 4 years ago, I had to give a talk again, and I hadn't looked at the literature in a long time regarding the funnel. But there's lots of support literature as to the benefits. We were able to accomplish a couple of them during our tenure with it while we still owned the company. One was a over 90% decrease in surface contamination of an implant when you're using the funnel versus the traditional method. And then from there, you project less capsular contracture based on less contamination and less biofilm. All those things factor into reducing the risk associated with an elective augmentation. And then we were able to show a decrease in capsular contracture rate or reoperation for capsular contracture by at least 50%. There are some updated studies based on that, but they are all supportive of the use of the funnel device to place the implants to limit capsular contracture contamination. From a side point, from patient standpoint, we all want to minimize our incisions, and especially some of the Asian countries that or ethnic countries that have scarring issues. The less you can incise, or the better you can hide those incisions, the better your end result. And with this device, you're able to place those incisions much smaller in very discrete locations, which in the long run has a big patient benefit from aesthetics, visual visibility. Those are some of the big points that I think have been beneficial that came about later after the product was to market, and practitioners adopted it and it found its way into the mainstream. That's when more of those benefits became, more publicly knowledgeable.
And I guess that in every occasion in which an innovation goes to the market, it has always been accompanied by controversy. And I guess that some of the plastic surgeons at that time, when they saw this innovation, they may have reacted, some in favor of it, some of them a little bit reluctant. How was it? How was the landing of the Keller Funnel into the industry at that time?
It was a struggle because things. The younger population of practitioners my age, which were facing similar issues, the reason I developed it, they jumped on board really quickly. But the old guys, truthfully, they were set in their ways. They didn't want to add any more expense to their procedures, and they do it just fine the way they have always done it. They didn't need that new device. So that's why we had to go a little bit further when we were launching, and to find and get some scientific backup for us. And then, it's a standard when people are comfortable doing things in a certain way. It's very difficult sometimes to push them into a trial of something that they may not see their benefit in it, but once they experience it, they actually come on board a lot faster. So it was a struggle. It took about 2 years and we were launching ourselves. So we were not launching with a big Allergan, Galderma, or a big company with a lot of bandwidth behind us. We were a small, launch. We were private. so we didn't have the wherewithal or like I said, the bandwidth to get to people as quickly. So it took a lot longer to get the word out as far as that goes.
And when it comes to implementation, we see that, well, there was pros and cons, and the benefits for the patients were totally clear. And when it comes now to seeing your career from now distance after 28 years of practice, what is the advice you could give to these doctors that are now starting, that the market is so crowded with so many offers, so many new tools, new elements? What would be your advice to those who are starting, how to move forward, how to create tools that ease their lives, but also bring benefits to the patients? What would be your expert advice for them?
So I think that's a two-limb question. One would be, how do you evaluate new technology and whether to investigate it? First of all, always keep an open mind, because regardless of what you think, you don't always know the best way to do things. And there are people who think outside the box. I have always, if I could tell you a little bit about my 28 years of surgery, I have always tried to simplify things, both for me technically and for patients, because if you can complicate anything, there's lots of ways to make things more complicated, but if you complicate it, it makes it harder for you, and a lot of times it adds recovery time and potential complications for the patient as well. So I have always strived to keep things simple, but keep an open mind for new technologies and new ideas. Mm-hmm. I'm a common sense. My academics are not as strong as a lot of people, as far as my knowledge and what you can test me on and what I would pass on a standardized test. But I have a ton of common sense, and common sense is your guide when you're evaluating, especially once you've had some experience and you know what's worked in the past and what hasn't worked, and then you just process it based on your common sense as to, that's not making a lot of sense from blood supply issues and from this issue, and you filter all that in, then you process it from common sense, and that's how you decide, well, this is a technology that might make some sense. Let me further investigate that. And then I guess my other advice to people, the second limb of that is, what do you do if you got an idea? First and foremost, make sure you got an NDA, which is a non-disclosure agreement. And because you don't want to give your ideas away, so make sure you're covered in that standpoint, but never hesitate to push forward with it and to find somebody who can help you. Because if you've thought of an idea, I can't tell you how many times at the booth with the Keller Funnel, people would say, oh, if I had only thought of that. Or they said, I have something similar to that in my drawer, I just never followed through with it. And I honestly have to give a ton of credit to God, because I prayed long and hard for that solution, because I didn't know that at that time, it was my first time with any kind of product development. I didn't know how to find a biomedical engineer. I didn't know how to start a company. I didn't know how to, I had filed a patent, a preliminary patent, but I didn't know how to go to the next step. So, there's a lot of jogging miles in the morning when I was praying hard for some guidance and some direction, and lo and behold, I got it every time. And so I have to give my credit to where it belongs for my success in that route. But don't underestimate your ideas, and don't sit on them too long, because they won't ever get done if you're waiting for somebody else to do it for you.
And this comes from a person, by the way, who has done it twice, because even the Keller Funnel was the first baby, let's call it like that, of Dr. Keller. He has already brought to this world a second baby that I know he's very proud of. He has also created some content for Hubmed Ed about that. And I'm super excited that he talks about this as well, because guess what? it also comes to solve another problem that patients were suffering. But I'm not saying anything else, and I let the expert telling us everything about.
So my second baby is the NavaClick, and our company name is Lineage Biomedical. And it's a little bit easier this time because I had some experience, so I wasn't going rogue, for so to say. I had my co-founder from my first company is with me and is CEO of the company and running things. So I will say it was a little bit easier to get to the point we're at now. However, we're running into the same struggles that we ran into before as far as adoption, because people get used to doing things their own way and they don't necessarily want to change. The impetus of the development of it was I left surgery and came to do aesthetic medicine, where truthfully the majority of what I do is injectables. And I hate multiple syringes. I hate the fact that the second stick on a TB needle hurts. I hate the fact that I'm 60 years old and I can't see the lines on the syringe, so I'm guessing as to what my accuracy is and what I'm treating. And I hate sitting or having some employee sit at a table in the back drawing up TB syringes and put on in the refrigerator. It's a waste of time. So the NavaClick system is designed to eliminate all that. We have vial adapters that attach to the vial to allow you to use one syringe per patient, one needle per patient. And that cuts down on my biohazardous waste, because I throw the needle away and then dispose the syringe in the trash. So there's tons of benefits. And then from a patient standpoint, the needle is a very tiny needle. It's extremely sharp, stays sharp the whole time. A sharp little needle hurts less than anything else, and it bruises less. So that's patient benefit. And then the other thing is, we've always been kind of nonchalant about, and even a confession, when I was in plastic surgery only, I guess I still am a plastic surgeon, but when I was doing that full time, I'd get in a hurry. I'd treat everybody the same. I didn't pay a lot of attention to my neurotoxin treatments, and I think we were doing patients a disservice. Truthfully, it is important, as important with a neurotoxin injection, to analyze patient movement, muscle movement, their structure, their shape, their symmetry, and guide your injections based on that. And now that we have a device that can deliver exactly 1 unit per click, regardless of your dilution, whether it be 1, 2, or 2.5 cc's, we can be extremely accurate. We can correct asymmetries. If one brow is higher than the other, we can help, maybe not get it 100%, but we can help control some of that. And we can do that because we can be very, very confident in the fact that we are doing exactly the amount of toxin. The other thing it gives us is, say we're seeing this new patient, we map her based on, or him, based on their movement, and we treat them, and we record that based on the level of treatment and the amount of toxin that we use. And they come back in their 3.5 to 4 months and say, I liked everything except this. Then I know exactly what we did, and we can tweak that treatment till we get it perfect for them. So it's got a lot of provider benefits, but there's just as many patient benefits. And I think we're going to see the same thing we saw with the Keller Funnel down the road, that once people, again, we're a small company doing our own launch. And once we get further along, we've already got a lot of people who are very supportive to us, that are very influential. But I think you're going to see some people doing some studies, and we're going to find that accuracy is important for patient treatment. And I always tell people, toxin is usually your first time of meeting someone. So if you get it right that time, then they're going to come back for some other stuff, and they're going to be your patient forever. So that's my second baby. I didn't mean to get ramped up on it, but we're in that phase of development where, we want everybody to start thinking about it.
And we all know that when a baby comes to this world, everybody talks about them. So it's totally fine. And we really appreciate that you share this knowledge about NavaClick with us. Another question is because NavaClick, one of the main important things from our perspective, and also for the new doctors who are always dealing with neurotoxin complications, is that NavaClick, as everything is maximally controlled through a click, complications are considerably reduced, the same as we saw in the Keller Funnel. You reduce the risks and complications there, you do it again here. How is NavaClick contributing to this reduction of complications by doing everything per click?
So those folks who have injected with TB syringes for their careers, or whatever syringes you use, you realize that a lot of times you'll get to the second part of your treatment and you're short the toxin that you needed for it, or you got too much. So you're not treating as accurately as you think you should. So it's pretty common with that technique to have and a lot of people do a standard 2-week follow-up to fix their or correct their, we call them touch-ups. But we see a lot less of that. As long as the initial treatment plan is appropriate, we see a lot less of returns based on asymmetric treatments because it's under such good control. The thing about toxin is the complications are not permanent. They don't usually require a reoperation like with the Keller Funnel or an implant that has a capsule contracture, but it's still patient time, provider time, and confidence. It interferes with confidence. If you have that constant touch-up that you have to do or correct for, and it really does. I'm not going to say it eliminates it 100%, but it is a very significant decrease.
And talking about decrease, you have here 2 examples on how to reduce complications, reduce risks, and maximize results by a person who has already gone a long ride through aesthetics medicine. I only have one last question/comment. Dr. Keller, I know that you've produced content for Hubmed Ed. I know that for you, medical education is something needed, especially for the new generation. So what would be the advice to them regarding education? What would be your main highlights for them, where they should focus their attention to grow on professionally and become a doctor like you with 28 years of well-reputation practice?
So starting out, there are a lot of good, you can get a lot from video content. You really can learn a lot, even from the very beginning, but there's no substitute for hands-on experience. And so I think it's important to balance those two. You can't learn everything you need on a video, but you also can't learn everything you need with hands-on if you don't have the right guidance. So make sure your choices are, your guidance is knowledgeable, and you usually would know whether you identify with an instructor pretty quickly when you're with them. But don't hesitate for to combine both video and hands-on experience. There was something else I was going to say. It left me. But so I know what it was. So listen to your patient. Always listen to your patient. You don't always know what's best for that patient. And so to build a very solid practice with a lot of loyalty to your brand and to you, if you sit, and the great thing is, I always did that with my surgical patients, but I didn't have the time to do it with my injectable patients like I do now. And if you sit and listen to them, then you will do a better job because you'll provide them more of what they're trying to get to. Now, I'm not saying you don't need to guide or to give guidance, because if somebody wants a certain thing and they're going to approach it in the wrong way, then it's your job to steer them in the right direction. And I will tell you, let's see, one of the biggest things I started doing once we got NavaClick was this sheet. And I think I show it in my educational stuff.
Yes, you do. Yes.
Patients love, I mean, and I don't want to say dumb it down, but I talk to them very directly. This is the muscle that we're treating. This is what it does. This is why we need to treat this. And patients respect that, even on a treatment like a neurotoxin, which is, you know, day in and day out, a very common procedure. They like to know that not only do you know why you're doing what you're doing, but they like to know why. Most of them, there's occasional patient here and there that don't want to know, but most people want to know why you're doing what you're doing. And it's easy to demonstrate with a mapping system like that.
And in the end, we devote our work to the patients and their benefits and their well-being. So yeah, it's important. Well, Dr. Keller, I keep this piece of advice to all our viewers. I am extremely grateful for you taking the time to join us today, to tell us all about your expertise and share it with our community so that they can follow your steps and grow professionally as you did. Thank you very much.
You are very welcome. And thank you for your time.
And to you who are there watching this podcast, this was our monthly podcast, and very soon we will come with another one to make you learn and grow professionally as Dr. Keller and the rest of our faculty. See you soon.